right, I'll be here.
Okay, good. Thank you.
There's our buddies. Everybody's getting on.
Wait, we see some faces.
People with cameras on. Okay. Well, we'll get started. Everybody's my screen is going crazy, flashing like all different kinds of
Yeah, hi everybody.
yeah, profiles coming up. Welcome everybody. I know everybody is muted right now, and we'll leave it muted. We have our tech person that's going to be running this meeting, so Kim and I don't have to worry about all the details of that like last time. And as people start to get on, we will start opening it up to Q&A. But we just want to say welcome to everybody. This is our second Zoom call for supporting you guys, practitioners, Q&A, whatever you want to talk about. We're really happy to talk about. We don't really have a set agenda for tonight. We have a couple different ways that you can ask questions. You can raise your hand and we can see your hand raised. Looks like somebody's already got their hand raised. And then there's a chat box, which I think we should find right now. Kim, find the chat box too on your side so that we can make sure we're monitoring that. Okay, got it. I got it open. So you can ask in the chat box or you can ask by raising your hand. So for the most part, I would say keep your microphones muted. Otherwise we get feedback from everybody. Anything you want to say, Kim?
No, I think that's it.
That's
Bear
it.
with us. We're kind of navigating all this, but we're looking forward to a good conversation on whatever you guys want to talk about. So.
All right, Patricia, you have your hand up. I think if you unmute yourself, you can ask a question. You took your hand down. Okay, maybe that wasn't, maybe you didn't need to have it up there. Anybody?
I can't figure out how to excuse me, I can't figure out how to raise my hand, but I do have a question.
Okay, that's good. Yeah, forget that.
Okay,
Yes.
sorry. So I'm not a practitioner yet. I'm signed up for the training in Bozeman this summer.
Thanks.
And I live in Idaho, and I'm really curious about what do you see as valid pathways to working as a professional outside of like becoming a massage therapist. So in my state, I don't have to, they have like an exclusion clause for craniosacral therapy, so I don't have to register with like the Idaho Massage Board. So I'm just curious what pathways to becoming a professional you see is most valid outside of like massage therapy.
I mean, honestly, I think the massage therapy route is the best way to go because you are covered. Because, sometimes craniosacral therapy can be slid in underneath other modalities that are not as hands-on, and CFT is a hands-on modality. So in order to be able to have, malpractice insurance and be covered and be legal. So you're saying you don't have legally in Idaho, you don't need a license to touch. Is that what you're saying?
I'm pretty sure there's an exclusion clause for craniosacral therapy and a few others. I don't recall at the moment.
Yeah.
I think it's kind of an issue of liability insurance. You're going to want to
Yeah.
have liability insurance. Unfortunately, we've never had an issue, but we do live in that kind of a world where you just want to make sure that you're covered, everything's above board. So, you may want to find some other practitioners in Idaho, and I don't know if I can think of any off the top of my head, but or other professionals in the bodywork world and ask them some questions about it.
Okay, thank you.
It's so tricky. Every state's different. Every licensure is different. But we are fans of getting it all above board and,
Yeah,
you know, figuring that out. But we look forward to seeing you in Montana.
thank you.
Anybody else?
Looks like Brittany has her hand raised.
Okay.
Hi, so I have a few questions. I'll just start with one though, in case I don't like hog. Will the tongue ever naturally rest at the roof of the mouth, like if you get enough CFT?
Where
Uh,
are you? I'm trying to see where you are. I can't see you.
I don't know.
It doesn't matter. I thought, yeah, it doesn't matter. Okay, sorry. Go ahead, Kim.
will the tongue, well, there's a lot that comes into play with that. Is there enough room in the palate for the tongue to rest? Number one. Is there a true tie where the tongue just simply can't get up there? Many times people will say that after CFT, particularly working with the oral structures, their tongue does have more freedom and more movement. The tightness has released a bit, and they are able to get their tongue up in the roof of the mouth and be more comfortable with that. So it's kind of depends on the situation. But what we do is we go in and we are releasing any tightness in the mouth that is not a true tie. If there is a true tie, CFT is not going to release that tie, but it will help relieve a lot of the tension and tightness surrounding it. Does that answer your question, Brittany?
Thanks.
Okay. You had a couple other questions? Go right ahead.
Yeah. Oh, okay. So will it help with growing pains? Have you had any success?
I've heard that
CFT.
question.
Yeah, we had that question recently.
Yeah, we had that question recently. I have not had any specific experience with that, but my answer with something like that is always, we don't know. And if it is related to fascial strain and we help release that fascial strain, they may feel some benefit. So I would say, yes, try it. Why not? You're not going to hurt somebody. You know, the worst that can happen in a case like that is nothing.
Yeah, true. And then if an area seems stuck, like it's not a still point, but it just like, what do you do? Like, if the arm's like in the middle of moving, all of a sudden it stops and it's like, just like hanging out, but it feels more like a stuck feeling versus like a still point.
Well, we always want to just give it a minute, you know, especially in the event of a still point. We want to allow the body to have a chance to reorganize and soften in that moment. So we don't want to rob the person of that opportunity, you know, thinking that something has to be happening right now. So whether it's a still point or it is a stuckness and you just feel like you've given it enough time and you've been hanging out there for, you know, what feels like an eternity, but it's really not. Give it a little invitation and, you know, does it want to go this way? Does it want to go that way? And if the answer is still no, I would just continue waiting and then just continue inviting. And eventually, you know, you'll feel either a softening and a shift coming out of the still point, or the unwind may start to move in another direction.
Okay.
Probably jump in on any of my answers if there's anything else.
Yeah, I mean, that's really what we talk about in class. Yeah, same exact thing that happens. So, and if you do, for some reason, you do take them out of it, if it's still going to unwind, they're going to go back to that, you know, they're going to go back to unwinding again anyway. So even if you somehow did rush them out of it, you know, it's not lost.
Okay. Thank you.
I mean, everything's yeah, in flow and always continuing to evolve. So we're just following it and yeah. Okay. Elodie, you have your hand up.
Hi.
Hey, Elodie.
I was just at the training with you guys in Melbourne, and I've worked on my first couple of babies in the last couple of weeks. I've worked on 2 pretty tied babies and had 3 sessions with each. And I was wondering, it's kind of going back to Brittany's question a little bit in terms of, I've noticed there have been general improvements, you know, with whether that's sleeping, bowel movements, and even a little bit more movement with the tongue and stuff like that. But I'm noticing that, there still might be some clicking while breastfeeding, and the other baby still prefers one side over the other. How much can we actually affect those types of things? If a baby is clicking a ton when breastfeeding, obviously I can see her tongue is pretty low in her mouth. There's more movement than when I first saw her, but it's still pretty low. Is it X amount more sessions that would help, or at this point, like, she probably needs to get that tie revised and then,
Well, is she working with an IBCLC? I mean, that's the question too, is like, we're a piece of this puzzle. We don't claim to go in and take over the whole.
right?
So if there is a lactation consultant or an IBCLC that would be willing to talk with you and collaborate with you, that's always great.
Okay.
Number one. And if there is a tie and the, IBCLC is thinking it's along those lines too, and you've given the baby, I'd give the baby more than 2 or 3 sessions. I mean, you want to be looking at the baby's cycle, the baby's nervous system, just generally overall, how's that baby doing? Because if you send that baby to a dentist, they're going to want to do the release right there. So I will hold back on sending the baby to the dentist until I would feel comfortable if the release happened that the baby is ready for it. So
Yeah.
there isn't a magic number of how many sessions. It's more, when you're looking with a baby who's having problems with nursing, a team approach, and definitely pulling in, an IBCLC if the baby doesn't already have one.
Okay.
How
Yeah,
old,
that's
how old
helpful.
is the baby, Elodie?
The first one was 2 weeks old, and this one is 5 weeks old that I
So
saw.
those are very young babies.
Yeah.
And they come in very tight. So I would say they need some time and more work and everything that Kim said.
Yeah. And I guess I don't know if it's not a struggle but
It's not
initially to
another.
get them to commit to those 3 sessions, and then, when it's like, okay, let's see how they do and get you back in a couple more. I find like more than 3 is harder to get people to commit to.
But if they're seeing changes, you want to be
Yeah.
pointing those changes out to them. I mean, they
Yeah.
want that one thing to
Yeah.
be resolved. But if there's other things that are happening along the way, that's what you want to be pointing out as well. And so, yeah, understood.
Thanks.
Yeah, you bet.
Brianna, you have your hand up?
Yeah, so sorry. No, hold on, Mama. Let me just okay. So I had a question. I've been working with a 7-year-old whose mom came to me because he was having like a lot of migraines, and the neurologist was going to put him on an antidepressant medication, but I had just gotten done doing this course with you guys in Arizona, and I was talking with her at the park, and I was like, well, let me try this thing, see if I can help you, and I need to practice. And so I've worked on him 3 times, and she said he hasn't complained of any headaches in 3 weeks. And so she's asking me, like, how do we continue to just do like a maintenance? Like, would you recommend like once a month for something like that, who's like chronically suffering from headaches? Or because he's been fine now, and so but she doesn't want them to come back because it's like he can't focus in school, and he's in bed all day pretty much when he gets them. So she just was
First
like
of all,
asking me kind of.
Congratulations.
Thanks.
That
Yeah,
is
it was so exciting
so
to hear
happy
that.
to hear that. That just like warms our heart when we hear your stories. So, what I would do in that case is I would just have a little bit of insurance in place, and I might say, what did you see him once a week, or how often did you see him those
Yeah,
first?
I did once a week with him.
Okay. So after the once a week, I might just say to the mom, why don't we check back in 2 or 3 weeks, and, text me, let me know if there's anything that slips back, any headaches, call me right away and let's get him in. But let's kind of spread it out and see how he does. When he comes back, how is his cycle? Is it the same as when it left? He's still feeling good. All right, how about we do a month? And then, you just kind of keep spreading it out. And as long as he is maintaining his cycle and he's headache free, I mean, that's great. I say, I'm here if you need me at that point. So
Okay.
the goal is always to move people on
Yeah.
People that just continually still want to come and they still come once a month just because life happens and it feels good. But a 7-year-old boy, I would really hope that, you unlock the key for him there. So that's fantastic.
Thanks. Yeah, I was pretty excited,
Yeah.
that he was it, because he even was like telling his mom, he's like, "Oh, I just feel so much lighter and better." And so he wanted to continue to get worked on because he just felt so good. And then he's trying to tell his mom to get worked on and telling his dad to get worked on, telling his little brother to get worked on. And
Yeah. So then
but
maybe the next session, little brother comes in and you split the session. You check in with the older brother, the 7-year-old, do a little bit of work with him, make sure he's moving nice, and then you start working with the other kids.
okay.
Yeah.
Yeah, because the little brother has really bad constipation. But he doesn't really sit still very well. But maybe now that does sit still, he'll
Yeah, you have
kind
to,
of go a little bit longer.
yeah. Well
But,
done.
all right. Thank
Good.
you.
That,
Now I have to figure out how to mute this.
Jagruti, you got your hand up.
Yeah, I have an update about the kiddo that I saw last time. Remember the one that was switching sides when he was tilting, and he had a helmet. So I saw him for 3 sessions, and apparently he had a clavicle fracture at birth, which mom did not tell us.
He had what? A fractured what?
A clavicle fracture.
Okay. Uh-huh.
So I felt like that was the reason why he had a very tight fascia on his left side that was pulling him into the left tilt. After 3 sessions, he came back into neutral, like midline. And mom was very happy. He wasn't pooping. He was pooping only once a week. So right after the session, a couple hours later, mom texted me like, "Hey, he's in midline, ballpark midline. Plus he pooped. He had a very big poop today." And she's been updating that he's been pooping. He's teething right now, so I'm expecting him to have some tilt. But other than that, the tilt hasn't switched sides anymore. And he's really doing great. So that's one update. My question then is, I've seen an adult patient, like mom of a baby, and she came in with left wrist pain, TMJ pain, hip pain, and neck pain. But when I saw her, and I've only seen her for 1 session, she said that she feels great overall. Like the wrist hasn't bothered her anymore. TMJ feels very relaxed. And during the session, she was like, "I feel like I want to laugh." Like, I don't know if it was like an emotional release because she had been keeping the TMJ and all of the muscles of the mouth so tightly clenched, and she herself has a tongue tie. So I was like, maybe it's just getting relaxed and you may not have felt that, relaxed as much in your TMJ, and that's the emotional release we are getting. I don't know. But she was like, I don't like, this is way very more relaxed. So that's what I got. So I don't know if that was the emotional release related to TMJ. But then the next day when I checked on her, she said that she feels overall sore in the neck, and the neck had gotten a whole bunch of unwinding when I was working on. So my question is it normal to feel sore after CFT just because the fascia is now getting into a new range of motion or newly unwound, so it's resetting the system? Is that something we need to let the patients know, that it's normal for you to feel sore after the session?
Was she moving around a lot?
So she was on the table, but we did a whole bunch of neck work, and her neck was moving a lot, like lot. And
Yeah.
I ended up doing neck release for like 20 minutes in the session, and then moved to, TMJ and then her wrist, because she had multiple pain points. And I was like, pick 3 for today's session. I can't release everything, but let's prioritize which 3 you want to work on. And she picked her TMJ, her left wrist, and the neck. So neck took like about 20 minutes. And then the rest we were like kind of moving back and forth between a TMJ and her wrist and her hip a little bit.
Pretty, something that you might try is remember the technique we talked about, the connect the dots. So she has these multiple areas that are bothering her. So when you're working with her, have her hold one of those spots, or you hold that spot and, you know, in this, wherever you are, you're up at the head in the occiput, you know, and you can reach down and hold the wrist, or, you know, because we want to see, are they connected and how are they connected in the strain? So you don't have to be so segmented. The wrist hurts, I'm going to the wrist. The neck hurts, I'm going to the neck, right? Because it's not always where you're going to follow the strain from.
Got it.
Yeah.
But then is it normal for us to feel sore after
Well,
CFT?
You can. I know where Holly was going with this. If someone is moving in a way that they're not accustomed to moving, their muscles can get sore from that, you know, from that movement. And then there's also the idea that if strain has released and the body's reorganizing itself and holding itself in another pattern, there may be muscles that are getting activated and it could be sore. So I always do tell people, look, you know, about the detox. There could be some detox. Tissues hold toxins. As the tissues get released, the toxins get released. Want to drink a lot of water, Epsom salt baths. I let them know that so they don't think that something bad has happened if they have a detox reaction. You can also say you may feel some soreness, but you know, there's that fine line between putting that into their consciousness and then also, but if it does happen, you don't want them to be concerned.
Got it. Okay. Yeah, because she went and saw a CST therapist in the area, and she was like, well, when she was working, I didn't feel any soreness or anything, like I was not moving a lot. Yeah, this is different than CST. And I told her, like, yes, because we are also hitting fascial system, so it's natural for you to unwind and experience some movement during the session and feel sore, because now we are, you know, altering your fascial memory. So I kind of played with it, and I let her know like CST and CFT are different. So you will feel different kind of release or experience within the two therapists that you're seeing. So
Right.
yeah, that's how I just let her know, like, this is normal. It's expected to do all these things. But she was here with her baby as well, so I did work on the baby, and then she was holding the baby as she was getting the release. So I feel like she was also holding tight, did not want to unwind because she was worried about the baby. And I told her, like, you know, I can put the baby on the floor, let him play with the toys while you unwind, so that way you are not holding certain areas of your body tight, because our whole goal is to unwind and not just be super tense during the session. So yeah, I'll keep you posted if I come across anything else with her, because she's gonna do another session soon.
Yeah.
That's
Okay.
great.
Try-
That's
try-
great news about your baby.
Yeah. Try to connect the dots with her though and see how that
Okay.
goes.
Yeah,
Okay.
I will. Thank you.
Millie, you have a question?
Yes. First of all, I'm a PT and work with very, very involved children. And I'm a craniosacral therapist, but I'm spying on y'all because a friend of mine told me to get on your thing tonight because I'm not getting my questions answered.
Good.
A lot of my kids have really bad spasticity and positioning issues because of birth trauma and all that kind of stuff. Ties are about the only thing they don't particularly have. Can I make a difference, or can my hands make a difference with some spasticity issues? What's your feeling on that?
Do you mean working with children that have CP?
Yes.
Yes.
Or any number of the horrible things that can happen. Yeah.
And are you saying with craniosacral therapy, or are you talking about if you do CFT?
CFT.
Yeah.
Because I'm really starting to move toward that way, because I'm thinking that's where that I could do the most for my critters.
What we find with CFT and with craniosacral therapy is that with those kids that are really involved, or with anybody where the fascial system is overriding the craniosacral system, then the results are not as good with CST. So yes, we do work with a lot of kids with special needs, kids with CP, kids that are very involved. And CFT is a part of that big piece of releasing the fascial strain, along with you know, some of the other modalities of reflex integration, the other things that that we're doing and referring out for that. But I have seen, yeah, a lot of great results with CFT with those kids that have, you know, a lot of I can't say it.
No.
Yeah.
And
Yeah.
what about Family Hope Center, Holly?
What's up?
Family Hope Center, do you want to mention that?
What do you
Well,
mean?
Okay, I don't know if you're familiar with Family Hope Center. Is a center where Barry actually worked for many years with very severely brain injured children. And I was able to work with him certain days there, and I was able to see the level of injury coming in from across the world that they worked with, and CFT was a big part of that protocol with their program. And like Holly said, they did lots of different things in that particular program, which we advocate for because we're not always the only thing. But in the cases of these kids, they're very tight. You've not taken our class, but we talk in terms of their brain cycle. It's probably at a 0. And when we start to open that up and we start to get a little bit of motion and release some of that fascia, and the brain's able to breathe and the fascia can be free, as Barry says, we see improvement. So can't always say what that's going to be, but it will help them and all of the other work that they're doing as well.
Great. Thank you. And I just
Yeah.
have to brag on y'all. The reason I even know about you is I had a relatively new granddaughter who went to somebody that from one of your classes, and like in record time, it's amazing. I was like, this is crazy. She
Well,
got
come
so much
join
better.
us.
So
Yeah.
I will always sing y'all's praises.
Thank you. Thank
Well, we
you.
hope to meet you someday.
Yeah.
Thank you.
No,
Awesome.
definitely.
Who else has their hand up?
I saw one. Who's that up in the corner there? I can't see the names.
Yeah, I can't see the name either. If you have your hand up, go ahead and unmute yourself.
Hi,
We
it's
can't-
Carla.
Oh, hi, Carla.
Hey, Carla.
Hi.
How are you?
I'm so happy you're doing this.
Aw.
I've been wanting to
You?
connect and so I opened my emails today and I went, oh, I get to do this. I'm so happy. So I
Yeah,
love
great
hearing
to
all
meet
the
you.
stories and so I've gotten back into my massage world, and most of my clients they lay on the table and they're not, I mean, the class, it was so much more dynamic, and I don't know how to, I don't work in the mouth much. I do a lot of jaw work. I mean, it has definitely shifted the way that I work with people big time. Like this has been one of the biggest shifts in my body work career, and I love it. But I feel like I'm losing it a little bit, that I'm like slipping back into my old ways. I don't know how else to describe it, but so anyway, I know you used to be a massage therapist, Holly, and so
It's
did you
really
ever?
tempting when you have those, when you've been doing something for a really long time. And there's no reason why you can't combine the other work that you do. So nobody says you have to do just CFT and you can't use any of your other techniques or modalities. But if you're trying to move toward more CFT, it's not massage. So people have to, that's not what we're doing. So
Right.
people have to know that. Do you have anybody that you can trade with in your area?
Nicole and I traded a little bit, but she's not a professional. I mean, I can't. I mean, she's not a massage therapist, and so it's hard to. And then the person who I love is Jessie up in Grand Rapids, but that's about an hour drive to go up to her place. And I have gone up and I actually went up and had her work on me and paid her because I just wanted to experience it again. So
in class, it's a different situation in class, and everybody comes back and says the same thing. So yes, we're in class. We are in a very unique situation there where we're all, there for the same reason. and we're learning together, and there's just a lot of safety in that room. And so people do let go a lot more than you're going to have a stranger coming into your office. They don't know what CFT is. They've never had it before. So I think you can just give them a little couple of like, hey, this is, sort of, you're going to be laying on the table. You may be moving around a little bit. If you feel that you want to exaggerate any kind of movement.
I always tell them that. I tell them that.
Yeah.
And it doesn't really happen. I mean, one guy I picked up his arm and it spun. I don't know. It seemed like for 5 minutes. It was like I kept inviting it to like lay down. No, but that was like one of the biggest movements I've gotten since I've been back.
Pay
Other than
attention
the
to
kids.
what's happening though under your hands, because it doesn't always look so
dynamic or
no, you will just feel things under your hands, even just a simple occipital hold or occipitofrontal, do a few of those things. It'll feel like clay melting under your hands, making these releases. And so give them a little invitation. Does their head want to move one way or the other? And if it doesn't, it's fine. But I think that you're probably making more progress than you think, because you're getting caught up in, somebody's not writhing on the table. They don't, that's not typically what happens. Sometimes, and the people who are writhing in my office are usually people who have been in class, because they've seen it, they know what's possible. But the average person is, they're a little buttoned up and they need a little bit of,
the kids flail around.
Or maybe you can find a couple of your clients that have certain issues that would do so well with CFT, like maybe they're headache people or migraine people or have had concussions or, whatever. And just say, hey, I learned this new thing. Would you mind maybe just for the first 10 minutes before I even get you on the table? Because again, you have someone on the table for a massage. They're typically naked. I say we don't do naked unwinding. So, we don't use sheets.
Well, I don't, they're not, I'm billing this as CFT and people do not take their clothes off. I explain the whole cycle. I do the cycles and, that lets them settle in. I mean, things have shifted for me. And I think maybe part of it is that I've shifted more and that's become the norm now. And I can't remember how I was before, but what I'm doing a lot of now, which changes, what has been the change, is that I hold a place, and instead of trying to have me loosen it up, I go somewhere else and try to unwind somewhere else, and hold that point that's tight. But I'm still looking for the tight spots. I'm still on an agenda that I want things to release. Of course, that's why people are coming, because they want more range of motion and pain. They want to be pain-free. So it's been more of a moving away from forcing release to asking for it.
Yeah, we never force, we follow.
Right. Yeah. Right. And it's tempting to get my thumbs in there, I mean, it's like my hands are so built to feel the ropey muscles and get in there and want to, get them. So anyway, it's been interesting. And then I did, is it okay if I ask another question?
Of course.
So I've been working with a little guy, he's 11, and he had hydroencephalopathy when he was born. And he's been coming to our Center for Neurooptimal, which is a brain balancing frequency that you do. And so anyway, he's had, I guess 2 or 3 sessions with me, but he's a chiropractor as well. But he has a shunt, out from his brain down into his, where does it go to? I'm not even quite sure. But and he loves doing the work. I mean, it helps unwind him. And because he's very, he kind of seems like he's on the spectrum, kind of, that, where he doesn't have a lot of impulse control. So so the last time there was his mom brought him in, it was because his chiropractor had said that he had fascial tension in his hips. So I felt it and I worked on it and it seemed to get better. Anyway, I don't know. I guess, have you worked with kids with hydroencephalopathy that have shunts, and does that ever change, or is there anything I need to know about him that would be helpful?
We talk about this in class. I mean, this is the one contraindication that we just
Oh.
don't put on kids with shunts, you know.
Oh, good.
I mean, it's just too,
Good.
I mean,
Okay.
I'm not saying that it wouldn't help them, but it's a
Right.
little bit risky because, you know, that shunt is there to,
Right.
you know, direct the fluid, and we would not want to displace that, you know.
Right. Right. Okay.
Yeah. So that is
Okay.
the sort of one.
Oops. Well, I'm
Yeah.
glad I brought it up. Yeah.
Yeah.
Okay.
Yeah.
Okay. Let's see, was there anything else? So my grandson, I just went to Guatemala and visited him, and he's 8 years old and still bedwetting and still has a ascended testicle. So I did a lot of the CFT with him. His bedwetting continued while I was there. And I didn't really know what to, I mean, other than just following his fascia. I didn't know if there was anything else I should have been doing with him. And do you see a change in kids that are bedwetting? And
I mean, bedwetting can be for many different reasons, and one of them is often related to oral function and the function of the tongue, and
yeah, because he did have a tie,
mouth-
and he had
mouth
that.
breathing. Yeah,
Yeah.
so mouth breathing,
Mhm.
you know, yeah. So that could be very much related to it.
Mhm. And just doing the unwinding as much as whenever I get my hands on him, right?
Yeah, I mean, that may not fix his bedwetting. I mean, there's probably other issues to address with his oral function and myofunctional therapy and, you know, nasal breathing and that type of
Mhm.
thing.
Yeah, I mean, I don't think he mouth breathes. I slept with him several times when his parents were out. And he doesn't snore or do, yeah. So anyway, I'll keep working on him.
Working on them. Yeah.
So, yeah. All right. Well, thank you. And the other thing is I would like to work with babies more. I've worked with 2 so far. I have a lactation consultant that sent them to me, and it was fantastic. I loved working with them. Any suggestions on, you know, I don't feel this hasn't been my world working with babies. It's not my, you know, like Jessie up in Grand Rapids, that's her world. She was already an oral therapist. And a lot of people who come to the class have already been working with kids, and I have not. So do you have any suggestions there?
I would
connect.
say,
Go
yeah,
ahead.
go ahead. No, go ahead.
I was going to say, I would connect with some of the birth professionals in your area and explain to them what you're doing, a little bit about CFT, and, you know, maybe start to develop a collaborative approach to care for these babies. Once you help one baby and that mom tells another mom and tells another mom, you will be seeing babies 7 days a week if you want. So just have to kind of get the ball rolling and network and explain, and that's, you know, how it kind of goes. Yeah.
Okay. All right. Thank you.
Thanks,
Good to
Pat.
see you.
See you.
Hey, Shelley, looks like you're next in line. There you go.
Hi. So, I am an OT, so I have been adding in CFT really into my practice working with babies, and it's been such a game changer. Like everything is just happens so much faster, and I've already been doing a lot of like oral motor work previously, and this just like everything just happens so much faster. So I've seen such great results. So my mom is really my question. So she is like such a hot mess, such a high palate, narrow palate, ties, sinus infections. Actually, when I worked with her one time, she like after I was done, she came up and like a bunch of things drained out of her nose. But she always tells me that she thinks I'm moving her. And like I feel, you know, pretty skilled in like manual therapy. I'm like, I swear I'm not moving you an inch. It's all of your work. And she says that she feels really dizzy after. And I know she has some reflex integration things going on, and like her vestibular system is so wonky, but she doesn't feel good afterwards. I'm like, it's supposed to feel good. And there's so much unwinding, especially when I'm in her mouth. And she just always feels so dizzy. So do you have any recommendations with that?
Does she have vertigo?
Like, not really, but everything just affects her differently. Like, she used to take NyQuil and used to keep her up. Like, I swear everything about her body is just the opposite. But her vestibular system, like, yeah, she gets like really dizzy when she does like yoga. She needs like or like if she like runs a lot, like she can't do that type of cardio.
Well, go easy with her because of the, like for those people that have vertigo and have sensitivity to vestibular stuff, you want to just take it down a couple notches and just really feel what's underneath your hands. It doesn't have to be a lot of movement to get the unwinding there. And it's also really hard to work on your own, people. So, if there's anybody like if you could trade with somebody where you work on their family member and they work on your mom, it's a whole different thing than, trying to, especially that's just, and it sounds like she does have a lot of things going on. Yeah. So she just every time doesn't feel good afterwards.
She's like, you're just moving. And I really do try to follow her. I tried to be so gentle, but her body just unwinds so much, especially when I'm in her mouth. I'm like, I'm not doing any of that. I'm not even really moving her at all. And she's just not in tune with her body, I swear. But I'm like, I am not moving you. She's like, I feel so dizzy. So I was thinking maybe I can just go, because I always work in her like face and head, neck. So maybe I should just go like more distally and kind of go down to like her sacrum, because I haven't really done that, or her legs and arms, and see if that kind of helps her a little bit.
I was gonna suggest that too. Because the goal is to get things open. So if she's not doing well, neck up, try from below, sacrum, even down at her legs, and see where that leads. And also, just since she's your mom and maybe you see her more often, you could work in little bits. You don't have to do like a whole big long session on her if she's not handling it that well.
Right. Okay, perfect. Thank you so much.
All right.
Patricia.
Okay. Hi, good evening. So I have three, wondering about if CFT helps with seizures, tinnitus, and vertigo. Those three separate physical issues.
I say yes, maybe yes.
Okay.
So your first seizures, have seen success with seizures. The thing with seizures that I have found is that seizures can bring the cycle back down. So a lot of times it's like you're moving forward and you're moving back, moving forward and moving back, with the hope that maybe the seizures come less often, or they're not as, what would the word be, like, intense. So yes, I have seen improvement with seizures. The second one was the tinnitus. So that one can be tricky, but I have had success with that, but there can be some other things involved besides fascial strain. So if it's just about fascial strain or the nervous system, and we can help with those things, we can see some improvement with that. But I do think that CFT is an important piece of that. And I know the nervous system is often, it really can ramp that up if the nervous system is ramped up. So if anything, we're helping calm the nervous system to put them in a better, environment for that issue. And then what was your third one? Your third one was?
Last one is the vertigo.
Vertigo, yes. Yes, definitely seen a lot of improvement with vertigo. Again, like Shelley was saying, you want to be careful with people with vertigo, that their head isn't, you're not whipping or moving their head in a way that's going to make it worse. So you are, yes, we're following the body, but as practitioners, we also are in control of, tamping down and making sure that it's a very gentle session if somebody is having problems with vertigo, because that's an awful feeling for them. So, but
okay, thank you.
Yeah, definitely find that with vertigo is helpful.
Okay.
I wanted to answer back. Oh, sorry. Thanks, Patricia. Answer back to Shelley's question. Danielle had put in the comment box, what about our atlas? So we had talked about that. We're always trying to also find the other missing pieces. If CFT is not getting them to where they need to go, And so we had talked about, I had talked about that. I've had a lot of success with very specific type of cervical, very gentle atlas work for people with very specific issues like vertigo, very specific TMJ, vagus nerve things. So that was a good point there, Danielle, to bring that up. So Shelley, that might be something that you look into for her as well, to have her, referred out to find somebody that does atlas orthogonal or upper, very specific, gentle upper cervical work.
Thank you.
Oh, we do have somebody. It's Jamie. Hey, Jamie.
Hi. Oh, can you hear me? So I just wanted to share. I had like a wild experience a few times, in a really good way. I work a lot with postpartum women and babies, which is like such a difference from when I worked with people in New Jersey. It was all like pro athletes and whatever. But what I've noticed, or a common theme that I've seen with 5 women now, whether they're 19 years, since they've had a baby, or a year postpartum, their rib cages moved back like 4 inches. And, it wasn't, I mean, I can't remember kind of how it all happened and where I was that led me to kind of just place my hands on either side of their ribs. And it looked like they took a really long exhale, and they just like vacuum sucked in three to, I think the biggest one was like 3.5 inches. Excuse me. Hi.
Ready?
And so it's been really cool, that, and also to the tinnitus question, I had a guy didn't even tell me on the intake form, and I asked that, and didn't answer it. And he called me the next day after an appointment and was like, "Oh, I forgot to tell you, I've had tinnitus for like 25 years. And all of a sudden I realized that I don't have it anymore." And I'm like, first of all, would have been nice to know that. Second of all, I'm glad. And this was like a month ago, and it hadn't returned, which is really cool. I mean, I can't claim that I did anything, but it resolved after our session. So it was quite a cool, like, little batch of appointments that happened in the last like couple months.
That's great. We love to hear that. And we really don't know, with the tinnitus. I've had some luck with tinnitus too, but again, I don't know why that some people, do and some people don't. Like Kim said, if it's related to, fascial strain and the cranial nerves, then we might make a difference for them. Yeah. Renee, you got your hand up?
Yes. Can you hear me?
Yeah.
I've been working on a baby that got a tongue tie and lip tie release. And they're saying that the baby, when they go to pick them up underneath the arms, they really cry like it hurts. Is that more strains releasing, or what is that?
Yeah, I'd have to see the baby.
Yeah, we would have no idea to just answer that when they say they pick him up and he cries.
How long ago was the release?
It was just on Friday, and I seen him that next day, and now I will see him again this week on Friday.
Well, that's a lot going on to see a baby the very next day. So they have a lot of, there's a lot going on with it. I don't usually work on babies the very next day after a release.
Okay.
So that might just be related. So it'll be interesting to see when you see him in a week, what is going on, with him. Yeah.
So you would recommend not to work on them right after a release?
I mean, there's, I think every baby's different, but some babies need, a little bit of time. I mean, that's a big, deal. And there's a lot of disorganization with their nervous system, with nursing, with everything. So yeah, I like the sweet spot of 2 or 3 days afterwards to work on a baby after release.
Okay. Okay. And I have quite a few questions on what's the difference between CFT and CST. How do you explain that?
So we have a paragraph written up on our website about that. If you go to the FAQ page, have you been to the website at all?
Yes, I have.
Okay. So what I would say, I would suggest that you go read that again. And it's a pretty it's pretty simplified. So I think if you read that again and kind of explain it to them, but I mean, in general, what we're looking for is in CFT or in CST, we don't find really good results when there's a lot of fascial strain in the system. So what we find is that CFT overrides the craniosacral system. So we have to address the fascial strain in order for the craniosacral system and nervous system to be able to regulate.
Okay. Yes, that makes sense. Thanks. That's all I had.
Thank you.
Brittany, you're back.
Yeah, I figured I didn't see anyone else with their hand, so I was jumping again. If you have someone with like really bad hygiene, like, do you have any recommendations how to approach it with them?
Kim, this is Kim's pet peeve.
That's why I always put in the class details, please be mindful of personal hygiene. It's tricky. I don't know. I don't know. I try to get ahead of it, particularly for class, because we're in a room with, all these people, and I want to be respectful of everybody who has to have work on somebody that, that they are comfortable. So I try to get ahead of it. I've never had to say that in my practice, like, please be mindful of personal hygiene before you come to me. But if you're in a population where that could be an issue, maybe you put that out ahead of the sessions. I don't know. It's a sensitive, dicey subject. If you would say to somebody, that's already come to you, hey, listen, do you think you could? I don't know. Whatever you want to say.
Yeah.
Yeah. So is that an issue that you're coming against?
Well, I'm asking it for my mom.
For your mom?
Maybe I shouldn't have said who I'm asking it for, but
Okay.
she's experienced it, and yeah.
Yeah, we have to. It's just the nature of things sometimes. So I think it's a matter of what you're comfortable with, but I always like to get ahead of a problem. So.
And then I had someone ask me this about, like, they get migraines and then they'll throw up and then their legs will shake really bad. Like, have you had clients that they experience that? And would that be like a fascia strain when their legs are shaking, or like just something going on with their migraine or energy release?
Yeah, migraines could be really wicked and debilitating, and definitely people can vomit, and I'm sure their body just goes into, shut down. But I would say you want to work on people with migraines.
Yeah.
That's the messaging and all of that. It's really number one, number two condition that I see here is migraines, and you will change somebody's life because they are so debilitating. So there's something going on. I guess they're definitely at a zero cycle. And if you give it some time and you work on them, may have less migraines. They're not as intense. They get out of them easier. Maybe they're not vomiting. Maybe the legs aren't shaking. Things will shift.
Mm-hmm. Thank you.
Yeah. Good luck.
Devin.
Hi, Devin.
Hey.
Hey, how are you guys?
See you.
Sorry, I'm jumping in. I was getting 2 babies down, and maybe this was asked, but I'm kind of asking for my own personal experience just with Everett right now. He's just been incredibly defensive. Like, I cannot get into his mouth. I can, but it comes with a lot of tears and a lot of fighting. Unless he's kind of distracted with a TV or something, but that only lasts for 30 seconds. It's not enough to get like a really productive session in. So I find myself working on him a lot in the middle of the night when he's sleeping, or like right when he falls asleep and he's kind of in a deeper cycle of sleep. But he's very consistently so defensive around like his frontal bone. He's very defensive around the TMJ area. So I know there's issues. But I wish I could get in there more internally with him, because I just took him actually to his dentist appointment today, and she's an airway pediatric dentist, and he still has a lot of tightness going on in there that I'd like to resolve for him. And I'm just trying to figure out how to get in there. I don't know. It's been very challenging with him.
How old is he now?
He will be 20. He's 19 months. He'll be 20 months at the end of this month.
I mean, that's just
He's at a tough age.
Yeah, it's a tough age. And, sometimes you just have to leave it alone for a little bit. Don't like, trying to get in the mouth, do CFT everywhere else. Work on him where you can get in there and where you're getting
Okay.
it, and work on him when he's asleep,
Okay. Yeah, I just feel like when he's asleep, I feel like I get so much more movement from him if he's awake. I don't know. Like I do get movement when he's sleeping, but it's more minimal, I don't know.
Yeah, I agree with Holly, is you have to go where you can and meet him where he is, and forcing yourself in his mouth is only going to make him hate CFT. So
Okay.
he is at a tough age, 19 months, that's tough. So,
Yeah.
that will change, and he will get older, and you'll be able to maybe, work with him a little bit more. But did he have his release done?
He did. He had lip and tongue at the same time when he was 3 months old.
Okay.
So, and he did he has improved because he got back to breastfeeding when he was not. So there's definitely been huge improvements, but he's
maybe you
tight.
could work on him, outside of,
Yeah.
But
But again, even that is when he's sleeping. Like he does not want me
Which
anywhere
one?
near when he's awake.
Yeah.
Yeah. Okay.
Yep. It's not you. Chakruti, do you have another question?
Yes, I just wanted to elaborate on Devon's question. Like, so is it okay if we are doing CFT when someone is falling asleep, or we can do that on a baby who is sleeping already? How do we explain, will we get unwinding since it's infant driven now that the infant is sleeping? How do we explain that we can still get work done? You know what I mean? Like, do they have to be awake, or does an adult has to be awake?
Working on a baby that's asleep. It's so great. Yeah.
Yeah. Yeah.
No, you
It's
can
great.
absolutely work on a baby who's sleeping. And
Okay.
it's just still just following their little body. They're still driving the movement, and it's it's very nice when they're sleeping.
Which is the same with my 7-year-old. Like the response time or time to stay still with me for my hands to be on him would barely be a minute or two. And then it would be like, is it done? Is it done? And they want to move, and he won't let me do things on him as a mom. So I just wanted to see if I can work with him while he's asleep and still, make a difference. Because he has a whole bunch of tongue ties and narrow palate, and we are getting things done for him now. So just wanted to see if this work will be effective even when kids are asleep.
Yeah, definitely.
Okay, cool. Thank you.
You're welcome. All right. Well, we are coming up on the hour. It's 7. And anybody have any last minute questions? If not, we will, oh, there's Yoko. Hey, Yoko.
Hi.
Hi, how are you?
Good, how are you?
Good.
Yes, so I have a question about helping out my teenage son who's on the spectrum. And you know, I guess I'm not, I haven't gone to massage school, so I guess the level of my confidence is just declining. And as someone said, it's very difficult to work on my own family member, except another son Noah. He's more in tune. And so basically, my son, he has had all the classic problems that a lot of CFTs or Dr. Gillespie trying to avoid. And now I just keep finding one issue after another. Now he has like a scoliosis, and I'm just wondering if I'm really able to, treat him, or, should I just, I don't know, start taking him to, somebody else. Yeah, I don't know how to feel the tightness, and, I don't know what this is, kidney, or that. I just don't know how
It's
to
hard
tell.
to work with your family members. Yeah, it really is sometimes. Not always, but sometimes it is. If you're finding it difficult, then I would take him to somebody else. I would take him to another professional CFT provider and let him get some sessions from them.
No,
Yeah.
okay. And from your experience, treating scoliosis, I know everyone's different, but how many, sessions, or is it easy thing to treat with CFT, or,
Cam, you want to answer? You've had some success with. You're muted, Kim.
I was coughing, sorry. We can never say how many sessions a certain condition is going to take, because we don't even approach it as if, okay, now I'm going to treat the scoliosis. We're just going in, we're finding the fascial strain, and the body's going to release, and body's going to heal in the way that it does. So don't get too tripped up on he has this, he has that, and I'm trying to treat this, that, and the other thing. Just go in and like you were taught, even if it's just occiput, frontal, sacrum, cervical spine, just those 4 basic techniques, Yoko, just start with that. And I think it's a bad idea to see somebody if you wanted to continue to take him to see, if you saw Barry, and then maybe you supplement at home, So I think that so many people learn these techniques to work on their family, and it is an invaluable tool to have. But sometimes I don't think it's, it hurts to go and get a session from someone else. But I would say keep practicing, keep working on them, don't give up hope. And that you're doing a great job. I mean, you went and you learned this as a mom to try to help your kids. And I think that you have a tool in your kit, and it doesn't have to be an either or, it could be both.
Okay, thank you.
You're welcome. Okay.
Right.
All right. Well, everybody, thank you so much for giving up an hour of your evening with us. I hope that this is helpful, and let us know, what you would like, if you want any other things out of this. But we love hearing your stories and your questions, and I hope that it is helpful. If anything pops up for you, you can always email us, and we'll get back to you with any questions that you may have. I think most of you seem like you were students, but some of you are just on learning about CFT. So we hope to see you in a class. We have, you can see our schedule on our website. We still have spots left in several of the classes towards the end of the year. Or actually, I even think we have some still left in Bozeman in July. So we are sold out for Colorado Springs in June. And the other exciting news is the practitioner directory will be launching Monday. We've been working really hard with our tech person, Amber, who was on here, and she is a saint working with us to get this up and running. So many of you have sent in your applications and have your profiles already up, and it really looks great. And it is so exciting for us to finally be seeing this in action so that people can find you as a professional. So if you have any questions about that, let us know. You can find the application on our website as well. And that's our update for now. So lots of great things happening. We love hearing your stories, and thank you so much for being a part of this amazing work.
Yeah. So we'll see you next time. We'll have another in a month from now, and you'll get all that on the newsletter. So just check those probably sometime beginning of June.
Mhm.
And yeah, keep up the good work. Oh, we should, well, no, I guess you already said that about, never mind. Never
Okay.
mind.
Okay.
Okay.
Good night,
All right,
everybody.
everybody. Until next time, have a great night. Mwah.